If you're stuck in that cycle of chronic pain and just awful sleepless nights, you know exactly how draining it is. But what if I told you that your pain and your sleep problems are not two separate issues? What if they're actually deeply connected, and an ancient practice like acupuncture might just hold the key? Let's dig in and find out.
So, does this sound like your life? You toss and turn all night, and when you finally wake up, you just feel awful. Your head's all foggy, you're exhausted before you've even had coffee, and you go through your day telling everyone you're fine when you're really anything but. You've probably tried it all, right? The painkillers, maybe some sleep aids, but nothing seems to get to the real root of the problem. Well, what if the answer isn't in another bottle of pills? What if it's been hiding in plain sight this whole time, and something you do thousands of times a day without even thinking about it?
Okay, so let's start with the stuff that's right there on the surface, the symptoms that you can see and feel every single day. Think of this as just the very tip of the iceberg.
We're talking about things like jaw pain, those nagging headaches, obviously the poor sleep, the snoring that might be driving your partner crazy, even things like acid reflux, and just this deep chronic tiredness that you can never seem to shake. All of these, they're not the problem. They're messengers trying to tell you something. And this is where we really have to shift our thinking. You don't catch a headache like you catch a cold. Pain is a warning light on your body's dashboard. It's screaming at you that something deeper, something fundamental, is way out of balance. But what's our typical reaction when that warning light flashes? Well, we try to smash it with a hammer, right? We shoot the messenger. We get so focused on just managing the symptom, we completely forget to ask what the message even is. And this creates a huge difference in philosophy. On one hand, you've got what the source material calls the disease management business, which, let's be honest, is incredibly profitable. It just masks the problem, often requiring you to take something forever. But the other approach, the root cause approach, is about finding the why and helping your body restore its own natural function, so the problem actually goes away.
Here's a great way to think about it. It's like having a slow leak in your car tire. Now, you could just keep putting air in it every single day. Sure, it's a hassle, but you can manage. Or you could find someone to take the tire off, find the nail that's causing the leak, and patch it properly. Because if you just keep ignoring that nail, you're basically just waiting for a complete blowout on the highway.
So if all that pain and the terrible sleep are just the low tire pressure warning light, then what's the nail? What is the real problem we've been missing? And this, right here, is the big reveal. The source material argues that we've been looking in all the wrong places. The issue isn't really your jaw. It's not your head. And believe it or not, it's not even fundamentally about your sleep. You see, we've got the whole thing backward. We talk about sleep-disordered breathing. But what if the real problem is breathing-disordered sleep? Think about that for a second. It means you're not waking up because you have a sleep problem. You are waking up because you literally cannot breathe correctly. So the snoring, the gasping for air, the waking up feeling panicked, those are all consequences. The root cause, the nail in the tire, is some kind of dysfunction that messes up your breathing. And when your breathing is compromised, your sleep gets destroyed, and your entire body is thrown into a state of constant stress.
So, once you have that aha moment, that this isn't just one little problem, it's a whole system issue, the solution becomes so much clearer. You can't just slap a Band-Aid on a systemic problem. You have to treat the whole system. You have to restore balance.
And this means we have to stop thinking in silos. Your body is this incredible, interconnected network. So to treat it properly, the source argues you need an integrated team. Not a magic pill, but what it calls a health village. So who lives in this village? Well, you might have breathing therapists to retrain that core function, myofunctional therapists to help with your tongue and facial muscles, a physio or osteopath to look at your posture. You might even have a dentist who is specifically trained in airway health. And, crucially, you'd have an acupuncturist to help bring the entire system back into harmony.
And acupuncture's job here isn't just about poking needles where it hurts. In traditional Chinese medicine, it's about harmonizing the flow of your vital energy, your qi, and your blood. By restoring that fundamental flow, it helps your body do what it does best: kickstart its own incredibly powerful natural healing processes.
As Dr. Louis Chan, who is both a dentist and a licensed acupuncturist, says, breathing isn't just about getting oxygen. It is the absolute cornerstone of our health. When your breathing is off, everything is off. It's that simple.
So, the biggest takeaway here is this profound shift in thinking.
We have to move away from just patching up the broken parts and start focusing on restoring the entire system. It's about recognizing that your body is an interconnected miracle, and true wellness comes from treating it that way.
And that really leaves us with one final question for you to think about. When it comes to your own health, are the treatments you're trying actually fixing the engine? Or are they just a quick paint job to cover up the dents? The answer to that? Well, it could change absolutely everything.